Well, good afternoon everybody. It's hard to believe that we're nearly in September. Children going back to school, lamenting the end of the summer and looking forward to what's going to be a very busy period in the health system. So lots of our preparations around that. We're doing a lot of work preparing our system. I've been issuing directions to colleagues about how we best set our system up for what's going to be a very busy period. So I've given direction around planning for there to be 0 patients waiting on trolleys in our emergency departments and on meeting our obligations around the waiting lists. Colleagues may know that we needed to reduce the number of people waiting by 9% this year, and we've done some great work because the number of patients that we've seen has increased by 13.5%, but our challenge has been that the number of patients referred to our services has increased by 15%. So a lot of hard work going on to reduce the number of people in our community waiting for our services. We are doing pretty well on the cancer targets, and I've issued direction we need to maintain the good work that's going on in cancer. I think everybody knows that we've got some fairly strict financial limits to meet, and we're working very hard to find some cost-saving initiatives that won't impact either on staff or patients. So really interested in continuing to get your good thoughts on that. So please send them in to andy.phillips@hse.ie, and we'll be using every one of those suggestions to get the best value we can from every single euro. So I've issued direction to the system around the 0 trolleys and the reducing number of people waiting for outpatients, and some of the technical measures such as making sure that on average there's no more than 1 new to every 2 review patients. But my part of the bargain is to find accommodation for colleagues. I've been working very hard with the states and other people from my office to make sure we've got enough outpatient accommodation. And this is where really the benefits of a regional system start to show themselves, because we're not going to have separate buildings for hospital outpatients and for primary care. We want people to be co-located. There's great benefits in being co-located so that we can have consultants from the hospital and the primary care teams working seamlessly together, really just building our systems around those people that we're privileged to serve. Of course, these changes mean a lot of disruption for people, and I apologise in advance that we may be asking you to move places of work. Of course, we will be consulting with you about that. I think colleagues know in particular we need to get beds into University Hospital Kerry, so we'll be looking to move the old outpatients in UHK into the Rathas building and designate that as an outpatient department permanently, and then find accommodation for people who are working in admin roles, particularly in UHK, so they can continue doing their valuable work. But the priority is to get beds into UHK, and we'll be really working hard on that. Let me turn now to CUH, where we're really trying to get some beds in advance of the winter. We have the old eye casualty department that we're busily working on now to make sure we can get some beds in there as soon as we can during the winter. So I'm very conscious that all colleagues need clarity of structure. You need to know who you're reporting to, what your accountabilities are, what your desk is, and I can absolutely tell you that the regional team is working very hard to give you that clarity as soon as possible. We're continuing to recruit colleagues to the senior post on the regional EMT, and I'll let you know about those as soon as I possibly can. But lots of recruitment underway, and we're continuing to have those national conversations about design of the integrated healthcare areas. Working hard to make sure we have all of the IHA structures designed, and so I can come back to you and tell you about those as soon as possible. So I'd like to think that we're a learning health system, and there's lots of things that we've learned about how we work with staff. I'm looking forward to the engagement with our union colleagues next week, and to talk about some of those things that they're really concerned about on your behalf. So once more, thank you very much for all of the hard work that you've done and you're continuing to do on behalf of our community. I'll be out and about again. I'll be in the hospital at CUH on Saturday, and I hope to see as many of you as I can over this next couple of weeks. Thank you.